Good morning, and thank you for such a warm welcome. I really am excited to be here today for the opportunity to serve as president of ASHP. We all know that journeys like this are not made alone. So at the very onset, I would like to thank my peers, my mentors, my work colleagues, my family, and my pharmacy friends for being here with me and being with me along my whole journey. You know you all mean a lot to me. And I have a special shout out to the ASHP staff who I've gotten to know well these last few years because I've come to depend on them highly also. I do have a few specific people I'd like to mention today, and I'd like to ask them to stand and turn around as I'm so thrilled that they're able to join me today. And this is my family. My three sisters were able to join us. My sister Terry with her husband Ken, Ellie and her husband Scott, Julie, who's here with her husband Marty, and their two daughters, Sandy and Sam. And although my older brother Steve couldn't join me today, I know that he supports me fully. Also here today are you can all stand up. Stand up, stand up, stand up, though. Also here today are yes, Jared, you can stand up too. Oh, I'm not done yet. My in-laws are able to attend today, Alan and Eileen Jolowsky, my sister-in-law Jerry, her husband Lloyd, and their son Jared. And even my cousin Jackie was able to join us today. So, thank you. Okay, now you can sit down. And my parents are gone, but I know that they're here in spirit. They were always very proud of the accomplishments of my brother, my sisters, and myself, and today actually would be no exception. And last, and I'm going to tear up, and obviously not least, I want to thank my husband, my lovely daughters, Claire and Nora, and yes, you have to stand up, who means so much to me. You're my rock. I didn't get a yoo-hoo out of Jerry, though. So you are my joy, my rock, and my sanity when things get hectic. You can imagine life at our house, huh? Okay, sorry. Today represents my chance to share my point of view, a little bit of my philosophy, let you know a little bit about who I am, and also to promote the works of ASHP. And in preparing for these talks, I turned to the wisdom of my favorite childhood author, Lewis Carroll, who wrote one of my favorite books, Alice in Wonderland. Now, Carroll's writings are known to be a little quirky, but also thought-provoking. So I'd like to share this conversation between Alice and the Cheshire Cat that I think is quite instructive for us as pharmacists today. Yep. Alice asked the cat, would you tell me please which way I ought to go from here? And the cat replies, that depends a good deal on where you want to get to. When Alice tells him, I don't much care where, the cat wisely responds, then it doesn't matter which way you go. This brings us to the question for us to think about today. Where are we going as pharmacists and as a profession? This question is followed by, how should we get there? And who do we need with us along the way? Unlike Alice, we care very much about where we are going. My destination, and from talking to many of my colleagues, it's your destination too. It's recognition for the value and the work that we do as pharmacists. Recognition through provider status to validate us as full members of the healthcare team. So if provider status is the where, how will we get there? We can best build a roadmap by paying close attention to the landmarks we need to hit along the way. What are the basic requirements for patient care? What are the practice models and patient care marks we need to pay attention to? Of course, if we just want to get somewhere near provider status, then we can afford to wander around a little bit. But that's not our goal. Somewhere near isn't close enough for us or for our patients. We have a very clear destination in mind, a place of better patient care, and more recognition for the value we bring as medication experts. Which means we must be very deliberate and strategic about the steps we take to get there. Advocacy will be a key part of our success, and ASHP plays a crucial role in this. The society is helping to create a roadmap that we can all navigate together. And even if we're traveling at different speeds, we must all be heading in that same direction. To do this, ASHP is guided by expanding care into ambulatory care practice, identifying new practice models, and creating the tools we need to get us there. But first, let me give you a little background about where I'm coming from. I mentioned earlier that my parents are no longer with us, but as with all parents, they shaped who I am, and their guidance helped to shape the pharmacist I've become. There were three main values that my parents instilled in me and my siblings. The first was the importance of getting involved and helping others. And these were not just words to them, they really lived it. Both of my parents were very active in the community. My father gravitated to formal leadership positions, many within the American Legion. My mother didn't really want her name up in lights, but she rolled up her sleeves and helped wherever it was needed. Her mantra for us was, "You're here, make yourself useful." My brother and sisters and I learned the importance of leadership and service, as well as the value of participation and teamwork. Second, my parents shared their true passion for getting involved and the important role that passion plays in our work. If we're passionate about something, we will be motivated to get involved and stay involved. And lastly, they always stressed the importance of education. All of us kids knew we were going to college. That was not even an option for us. And what this did is it instilled in us the passion for lifelong learning and growth. Now, this is why I always made sure I was available to help my girls with their homework, whether they liked it or not. And math was the area that I thought I could be the most help to them. But this presented some challenges, because math, when my kids were little, was taught differently than how I learned it. Yet, the math problems are the same, even if we approach them different ways, right? We had to get on the same page if I was going to help them understand complex math problems without too much frustration. And I know I didn't always succeed. For me, math could always be distilled into small, simple equations. And in each equation, there was some known or constant, some variable, and some element that was missing. So I know we're all familiar with solving for X. Now, I was thinking about different approaches to math problems, and I started to look at my professional life in the same prism. And my first thought was to solve for what's missing, solve for X. So what does that mean for pharmacy practice? Well, in a recent intraprofessional meeting, we were discussing the members of the healthcare team, who the people are, and what their roles were. I looked at the participants, and I started wondering who was missing. Who else should have been there? Who needs to be present to learn from what we are doing? And how do we bring our value as pharmacists to those people who are not in the room? Now, the same could be asked from an organizational perspective for ASHP. As we continue to advance practice across the continuum, who needs to be at the table? Are we fully engaging our members, potential members, students, pharmacy technicians, other stakeholders? What else do we need to do to make sure that we are connected with each other within ASHP and with our external stakeholders to be the most successful at moving practice forward? Now, in my work at the college, I talk to students all the time, and they often ask me about my career and how I got involved in ASHP. I share the decisions I've made as my career developed to follow my passion for advancing practice. I stress the value of networking. I stress the value of working with their peers and potential mentors. And I also emphasize the importance of tapping into the knowledge and the expertise of those around you. All of these are values that will lead us where we want to be. Which brings us back to Alice in Wonderland. If you don't know your destination, then it doesn't matter which way you go. It is the involvement, the sharing, and the passion that help define that destination for me. So all this thinking about life in the context of math problems brings me to a new equation. Pharmacist involvement in X times passion is equal to better patient care and more recognition for pharmacist value. Now, in solving this equation, we're faced with many variables: grassroots advocacy efforts, support from decision makers, recognition from payers, the need for quality improvement, and the need to follow our patients along the entire continuum. There are also several constants in our equation, including the strength of our practitioners, including our new and future pharmacists, and advanced clinical practices. What other information is missing in order for us to solve this equation? Recognition as providers, a common understanding of the value of pharmacists, the need to continue to advance our knowledge and training. Now, all of these variables, once figured out, multiplied times passion, will make this equation solvable. Let's take this to another level. I believe that pharmacists are the constant in our patient care equation. We are present in every patient care transition and practice setting. Not too long ago, the pharmacist's approach to care was focused on the patient when they were in front of us. That didn't take into account what was going on during the whole life of our patients. And often, we didn't have access to that information. But today, our focus is on the whole patient and their entire life, along the full continuum. This is going to shift our mindset regarding patient care. Our patients are no longer snapshots in time as they come in and out of our care. We were accustomed to handing our patients off to practitioners in other care settings, but increasingly, we are the ones in those other care settings. We need a consistent patient care delivery model that includes discharge planning and follow-up care, a model that extends from the hospital to long-term care, to ambulatory care clinics, and back as necessary. And what are we doing at ASHP to support this? ASHP is focused on achieving provider status, working with those at the state level to expand our scopes of practice, and growing our tools and resources to help all of us be better practitioners. Now, some of these settings may represent environments that we're not familiar with, yet this is exactly where our value is amplified by working with other members of the healthcare team. Pharmacists as the constant in solving patient care equations provided me with a new way of thinking about my own career. I served in leadership positions in health system pharmacies for more than 25 years. Early in my career, I knew that I wanted to be in a position that would create change. And it was clear that leadership roles would provide me that opportunity. One of the things I especially enjoy is organizational management, figuring out what works to improve patient care and safety and what doesn't, whether that's education and training, engineering, or technology. So how does my career path, which actually took me in a direction I did not originally foresee, reconcile with my imperative today that we must keep our destination in mind? It demonstrates that we must be open to adjusting our path in order to get to our destination. At my college, I find that students are certainly focused on their closest destination: graduating, residencies, finding their first job, and making themselves marketable, all which is understandable. Yet, in their rotations and into their residencies, I encourage these students and new practitioners to focus on the skills that they are learning, which will serve them well into the future. That's why I'm very passionate about residency training, because it provides a positive and supportive environment that fosters critical thinking and decision-making skills, skills that are needed in pharmacists today. Likewise, ASHP is working hard to expand residencies and support board certification. understanding that these skill sets will help students stand out in their future careers, and it will provide a framework for employers to see what is special about them as individuals. So, let's go back to my kitchen table when I was helping my daughters, Claire and Nora, with their math homework. When we want to solve our professional pharmacy problems, we need to ask questions that I asked my daughters. What is the value that we are given? What is the known entity or constant in our equation? And what or who is the missing variable in our equation? To solve this problem, I hope I have you thinking about the role of pharmacists. We have to establish ourselves as the constant in the equation, which means we must have a handle on some big concepts, such as what are the needs of the patient? Where is the pharmacist? And what are the gaps in our care delivery system? This equation analogy continues with finding the missing element. What, or in our case, who, is missing from the equation? I want you to ask yourselves this same question when you participate in meetings here this week. We have the Medication Safety Collaborative, the Informatics Institute, and the Pharmacy Practice and Policy meetings. Look around when you're in those meetings and ask yourself, how can we reach out to people who are unable to attend and to connect them with the rich content of the meeting? There are people who need to be here so that they can benefit from the great information and great networking opportunities that we have available. Are we doing all we can to bring them into the equation? Specifically, where are the students? Residents, our preceptors, fellow colleagues, maybe those in different practice settings, staff pharmacists, and technicians. There is value here for all of them. Value in participating, or even simply observing, the policy process through our House of Delegates. Value in hearing the inspirational words from our Whitney Award recipient and ASHP past president, John Murphy. Value in the education that's offered here this week. And of course, value in the unique networking opportunities. Now, we can ask these same questions of ASHP. How do we involve more pharmacists as members? How do we involve more ASHP members in the organization's activities and initiatives so that they get the full value out of belonging to ASHP? Because you know that we truly only get out of the membership what we put into it. We need to encourage more members to be fully engaged so that they get the value out of their membership. Now, let's keep going with this part of the equation. Who is missing from our practice experiences? Are all of the stakeholders accounted for? What about patients and their caregivers? Are we including them in the decision-making about their own care? What about our own administrators and regulators and legislators, both local and national, who hold so much sway over what we can do and how we do it? We need to make sure that all the missing variables are solved and in place. That way, we'll be able to work together to achieve the best outcomes for patient care. Clearly, this is a complex, seemingly endless equation that few have actually solved. We're still working on it, and it's critical that we do not give up on this one. We need to be persistent. As we make important decisions about policies, therapies, and what the future pharmacy should look like, we must ask ourselves, are we fulfilling our role as the constant in the patient care equation? When decisions are made about medication use in our practice settings, are we present, visible, and easily available to the patient? In today's healthcare environment, we need to focus on the patient's needs across the entire spectrum of care. The days of treating a patient for a few days in our hospital and then waving goodbye with best wishes as they left, clutching their prescriptions, are over. So this brings me to another equation I want to share with you today. It's an equivalent equation. The future of ASHP is equal to the future of pharmacy. As I start my presidential year, I am absolutely thrilled about the direction of ASHP. and there's so much to be excited about. Our new mission, vision, and strategic plan, which focuses on all patients and all aspects of care. The Pharmacy Practice Model Initiative, including our recent work into the ambulatory care arena. Our efforts to achieve provider status. Our new brand and logo, which represents us as a contemporary, strong, and forward-thinking organization. Our growth in members, which means that more and more practitioners are finding the value of being part of ASHP. Our work to help members manage critical practice issues, such as drug shortages and compounding. The tools and resources that ASHP creates to help all of us in our daily practices. And ASHP's work to partner with others to further our influence on public health policy and advance your role as healthcare providers. So let's go back to my first pharmacy equation. And I'd like you to ask yourself, how do I fit into that equation? Are you the constant in the patient care equation at your work site? And what about your professional associations? Are you fully engaged at the state and the national level? There's so many ways that we can get involved to advocate. Advocate for your patients, advocate for change, and improve your patient care setting. One great way to do that is to make your presence known on ASHP Connect, which is our social networking platform. This is where you can contribute to profession-wide discussions about critical practice issues. Another question to ask yourself, how can I share my knowledge, my experience, and wisdom with others so that they can improve their own patient care practices? Next, make sure you know where you are going. Find your path and adjust it as needed. When I started my career, I really did not set out to lead key professional initiatives or to be a director of pharmacy or to be president of ASHP. I did, however, set out to do something I was very passionate about. I wanted to make an impact. I wanted to improve the patient care process. When I started my remarks today, I talked about Alice in Wonderland and the idea that if you don't have a destination, you'll certainly wind up somewhere, but maybe not where you'd like to be. Well, I can assure you that as a profession, we know who we are and where we are going. We are the members of the healthcare team who need to be part of every decision regarding medication use. And as an organization, ASHP also knows who it is and where it's going, leading the way on PPMI, provider status, our vision, mission, and strategic plan, and our focus on the entire continuum of patient care, including ambulatory practice. We are moving hand in hand with you toward providing the best care for our patients and ensuring that pharmacists are recognized as the constant in the patient care equation. So let me end with one last equation. And this is one to solve, and I've placed pharmacists as a constant. We have pharmacists, plus our residents, plus students, plus technicians, plus the healthcare team, and of course our patients, which leads to the best patient care. Now, today I realized I've asked a lot of questions, and I have just two more. In looking at this, where are you in the patient care equation? Are you the constant in your practice setting? I believe that it's time for us to take our place as the constant in patient care. And I actually have one last question. I want to know what you're doing in your work sites to improve patient care in your organization. So you can email me. So I actually have an email address at ASHP. So I really do ask that you share your stories because we know how powerful stories really are. So I do want to thank all of you today for doing everything that you do in your daily practice to keep pharmacists as the constant in our patient care equation.